All right, Mr. Smith, what can I do for you today? Well, my nose started running a few days ago. I got a little tickle in the back of my throat, and then my ears, and then they were popping whenever I would yawn. I don't think I have a fever. I don't think I had a fever, but I might have had a fever. Ibuprofen, water. See you later. Well, my ear is kind of, it feels like there's water behind it, and ibuprofen and water. Okay, thank you. My back hurts. What's that? Ibuprofen and water? It'll cure anything. Well, my throat hurts a little bit. But thanks. My leg hurts. But Motrin, and water. Hey folks, welcome to another episode of Better Off Med. I think I need a tagline. I don't have anything to say after that. A good rule of thumb to keep in mind is that all medicine is poison. We just dose it low enough so it doesn't kill you. So with medications, more is rarely better. And if you've been taking something for a long time, you should go to your doctor and find out if you really need to be taking it. So a great example of a medicine that's overused is ibuprofen. People pop it like candy and think the more that they take, the better that they're going to feel. Nothing could be further from the truth. In fact, today's episode is going to be dedicated just to ibuprofen to show all the good things and the bad things that can come about when we take too much of this common medicine. First off, what is ibuprofen? Ibuprofen belongs in a family of medicine that we call NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs are some of the most common drugs that we can buy over the counter, and they have names like ibuprofen, Motrin, Advil, Aleve, naproxen, naproxen, can't think of others, Excedrin, aspirin, baby aspirin, all those are in the category of non-steroidal anti-inflammatories. NSAIDs work by reducing a chemical that our bodies create called prostaglandins. Prostaglandins promote pain, inflammation, and fever in our bodies. They also help protect the lining of our stomach from its own acid. Reduced prostaglandins increases your chances of having gastric ulcers. This is by and far the most common side effect of overuse of NSAIDs, and they can actually kill you. Side note, taking a specially coated formulation of NSAIDs, usually called enteric coated, are meant to protect our stomach from contact with non-steroidal anti-inflammatories. And people think by taking these, they're protecting themselves from actually getting an ulcer. This couldn't be further from the truth. Remember, the ulcers aren't created by the pill hitting the surface of the stomach. They're being created because our body is no longer making prostaglandins. And prostaglandins are necessary to protect the lining. Get rid of that, increase your acid, you're in for a world of hurt. Is more coffee better? I think so. It is. If you're over the age of 50 and you're popping ibuprofen like candy because, let's be honest, if you're over the age of 50, you've got a lot of aches and pains, you're setting yourself up for a world of hurt. The most common side effects of non-steroidal anti-inflammatories are nausea, vomiting, dizziness, fatigue, rash, reduced appetite, widespread swelling of the face, the hands, the feet. This is secondary to a slight downtick in your kidney function when you take them. If you have asthma or allergies, believe it or not, taking an NSAID is dangerous because people with asthma have a greater risk of having an allergy to non-steroidal anti-inflammatory drugs. The last thing which a lot of people don't realize is that taking non-steroidal anti-inflammatory drugs can lead to an increased risk of heart attack. Now, this isn't including aspirin, and we'll talk about that in a second. This is especially true with people with a history of coronary artery disease or have risk factors for a heart attack or stroke. Heart attack and stroke risk can increase even with the short-term use of the medication, and the risk extends weeks after the medicine is stopped. The risk increases with higher doses over longer periods of time. So if you're one of those guys who smokes, drinks, eats poorly, and is popping 4,000 milligrams of aspirin or NSAIDs a day, you're really asking for some trouble. The problem lies when we rely on medicine over lifestyle change, diet modification, exercise regimes to get people feeling better. If you think that your answer is going to lie in a pill and not work on your part, then you're gravely mistaken. Now, it's a free country. You can go down that path and say, every time I have an ache and pain, I'm taking 800 milligrams of Motrin, and I'm doing this 6 times a week, 300 days a year. It's probably not a good idea. You should probably find out why you're aching and why you're in pain and why you think you need so much of this medicine. So that's it, folks. Medicine is poison. We dose it low enough so that we don't kill you and that we get the desired result. So be smart, take care of yourself, and stay tuned for another episode of Better Off Med. I'm your host, P.A. Sully. Thanks for checking out Better Off Med. I'm your host, P.A. Sully. Hit the subscribe button below, hit like, hit notifications, hit all that stuff. I'm trying to build this channel from scratch, a lot different than my podcast, which is over at waitwithif.com. If you like deep conversations about what makes the world go round, go check that out, www.waitwithif.com. That's pretty much all I have for this week's episode. So I will see you soon.